When someone we love begins to show small, seemingly insignificant changes in their health or behavior, it's easy to dismiss them as a normal part of aging. Many people assume that death in old age strikes suddenly like a light switching off. However, the reality is often far more gradual, with the body sending quiet warnings, sometimes as early as a year before life reaches its final chapter. These signs are frequently overlooked because they blend into the expected aches, pains, and slowdowns of growing older. It's only when looking back that families often realize the clues were there all along, but by then it's too late to prepare or make those final moments truly count. In this guide, we'll explore 5 critical signs that may emerge in the year leading up to an elderly person's passing. Some of these changes might be ones you've noticed but brushed off as just aging. Others may seem so subtle that they barely register, yet they point to the body's gradual decline. Recognizing these signs early offers a precious opportunity, the chance to provide compassionate care, create lasting memories, and ensure your loved one's final days are filled with comfort, dignity, and peace. Stay with us until the end, as these insights can help you prepare both emotionally and practically for what lies ahead. By understanding these changes, you can avoid being caught off guard and make the most of the time you have left with those you hold dear. Let's dive in. On unintentional weight loss, a silent signal of decline. One of the earliest and most significant indicators that an elderly person may be nearing their final year is unintentional weight loss. At first, it might seem like a minor shift, a belt that needs tightening, clothes that hang a bit looser, or a loved one who seems less interested in meals. Families often attribute this to the natural aging process, assuming it's normal for older adults to lose a little weight as they grow older. However, significant weight loss without effort is rarely a positive sign. It often signals that the body is struggling to maintain its basic functions, hinting at a deeper, more serious decline that requires attention. Aging naturally leads to some loss of muscle mass, a condition known as sarcopenia, which can cause a slight reduction in weight over time. However, rapid or unexplained weight loss suggests something more concerning. The body may no longer absorb nutrients efficiently, or it may struggle to process proteins, leading to muscle wasting. This loss of muscle doesn't just affect physical appearance, it weakens the body, making everyday tasks like walking, climbing stairs, or even holding a cup more challenging. It also increases the risk of falls, which can lead to fractures, bruises, or other injuries that are harder to recover from in old age. A weakened body is also less able to fight infections, as the immune system relies on proper nutrition and strength to function effectively. Appetite changes are a common culprit behind this weight loss. As people age, their sense of taste and smell often diminishes, making food less appealing or enjoyable. A loved one who once savored home-cooked meals might now pick at their plate, skip meals entirely, or show little enthusiasm for foods they once loved. For example, they might push away a favorite dish saying, "It doesn't taste right," or eat only a few bites before losing interest, even if they haven't eaten all day. This isn't just a matter of preference, it's a physiological shift. As the body begins to slow down, it may stop sending hunger signals to the brain, as frequently leading to reduced energy, diminished strength, and a gradual decline in overall health. Underlying medical conditions can also drive weight loss. Chronic illnesses like cancer, heart failure, kidney disease, or chronic obstructive pulmonary disease (COPD) often cause weight loss long before other symptoms become obvious. These conditions can interfere with the body's ability to process nutrients or increase its energy demands, leading to a wasting condition known as cachexia, where the body consumes its own muscle and fat reserves. Even emotional or cognitive issues such as depression or early dementia can reduce appetite, creating a vicious cycle where the body lacks the fuel needed to sustain itself. For instance, a person with depression might lose interest in cooking or eating, while someone with cognitive decline might forget to eat, skip meals, or struggle to prepare food due to confusion. Families often try to address this by encouraging their loved one to eat more, offering favorite foods like homemade soup or desserts, or introducing nutritional supplements like protein shakes or meal replacement drinks. While these efforts come from a place of love and care, they may not always be effective. If weight loss persists despite these interventions, it's a sign that the issue goes beyond diet. The body may be preparing for a deeper transition, redirecting its energy away from maintaining muscle and toward preserving vital functions like heart and lung activity. Forcing large meals can cause discomfort, nausea, or even digestive issues, especially if the body's ability to process food is compromised. Instead of focusing on reversing the weight loss, prioritize comfort and quality of life. Offer small nutrient-dense meals that are easy to chew and digest, such as creamy soups, smoothies, mashed vegetables, or soft fruits like bananas or applesauce. Ensure they stay hydrated, as dehydration can exacerbate weakness, confusion, and other symptoms. For example, keeping a water bottle nearby or offering flavored water, herbal tea, or electrolyte drinks can encourage sipping throughout the day. If your loved one is losing weight rapidly, say more than 5 to 10% of their body weight in a few months, consult a healthcare provider. They can assess for underlying conditions such as cancer, thyroid issues, or gastrointestinal problems, and recommend strategies to support comfort such as dietary adjustments, nutritional counseling, or palliative care. If you notice significant weight loss in an elderly loved one, especially if they're eating less, feeling weaker, or struggling to stay active, don't ignore it. This isn't just about how they look, it's about the body sending a message that it's entering a new phase. Recognizing this early allows you to approach the situation with compassion, make informed decisions, and focus on creating meaningful moments. Whether it's sharing a small bowl of their favorite ice cream, enjoying a quiet meal together, or simply sitting by their side, these moments can bring comfort and connection in their final months. 2. Profound fatigue and weakness. When energy fades away. Another hallmark of the final year of life is a deep, persistent fatigue that doesn't improve with rest. This isn't the kind of tiredness that comes after a busy day, a sleepless night, or a long walk. It's a profound exhaustion that makes even the simplest tasks feel overwhelming. Getting out of bed might take immense effort, requiring assistance or long pauses to gather strength. Walking across the room could leave them breathless, unsteady, or needing to sit down. Activities that were once routine, like dressing, cooking, bathing, or engaging in a conversation, may now feel too draining to attempt. This fatigue is a clear sign that the body is conserving its limited energy as its systems begin to slow down. This exhaustion stems from several physiological changes. As we age, the heart's ability to pump blood efficiently declines, reducing the oxygen and nutrients delivered to muscles, organs, and tissues. Circulation weakens, leaving the body less capable of sustaining physical activity or even mental focus. At the same time, metabolic processes slow down. The body is designed to produce and use energy for movement, thought, and repair. But in its final phase, it redirects energy toward essential functions, like keeping the heart beating and the lungs functioning. This shift leaves less energy for daily activities, resulting in weakness, unsteadiness, and a need for more rest. You might notice your loved one sleeping more, taking longer naps during the day, or struggling to stay awake for extended periods. Some may experience sudden energy drops, appearing fine one moment, but completely drained the next. For example, they might start a conversation with enthusiasm, but trail off mid-sentence, too tired to continue, or sit quietly after a short walk, needing time to recover. These changes can be frustrating for both the individual and their family, especially if they were once active and independent, perhaps known for tending a garden, playing cards with friends, or hosting family dinners with energy and warmth. The emotional toll of this fatigue is significant. Many elderly individuals take pride in their ability to manage daily tasks, whether it's cooking a meal, maintaining a tidy home, or pursuing a hobby like painting or knitting. Losing that independence can lead to feelings of frustration, embarrassment, or even shame. They may withdraw from social interactions, skip family gatherings, or stop engaging in activities they once loved, not because they've lost interest, but because they simply don't have the energy. This withdrawal can create a cycle of isolation where they pull back further, accelerating their physical and emotional decline. For instance, a grandparent who once loved woodworking might stop visiting their workshop, not out of disinterest, but because the effort feels too daunting. For families, watching a loved one shift from vibrant and engaged to exhausted and withdrawn is heart-wrenching. It's tempting to assume they're giving up or need to push through the tiredness, but this fatigue isn't something they can control. Encouraging them to stay active beyond their limits can lead to frustration, agitation, or even injury, such as a fall due to weakness. Instead, focus on adapting to their needs. Create a restful environment with comfortable seating, soft lighting, and minimal physical demands. Encourage short, low-effort activities that bring joy, like listening to their favorite music, looking at family photos, sharing a brief story, or watching a beloved movie. These moments can maintain connection without draining their energy. If you notice your loved one experiencing ongoing fatigue that rest doesn't relieve, take it as a sign that their body is undergoing a significant transition. This is the time to cherish quiet moments, offer gentle support, and let them rest when needed. What matters most isn't how much they can do, but how loved and understood they feel. Simple gestures like holding their hand, offering a warm blanket, or sitting quietly by their side can provide immense comfort and reassurance in their final months. If you're finding this information helpful, please leave a comment below with number 2 to let us know you're following along. Your engagement motivates us to keep sharing valuable insights to support you on this journey. 3. Cognitive decline or emotional withdrawal, a fading connection. As an elderly person nears the end of life, you may notice subtle but significant changes in their mental clarity, communication, or social engagement. Someone who was once sharp-witted, talkative, and engaged might start forgetting small details, struggling to follow conversations, or becoming disoriented in familiar settings. They might repeat stories, forget names of loved ones, or lose track of time even if they've never shown memory issues before. These cognitive shifts can begin months or even a full year before death, serving as early indicators of the body's decline. This isn't just everyday forgetfulness or senior moments. The brain, like any organ, relies on a steady supply of oxygen and nutrients to function properly. As circulation slows and the body's systems weaken, cognitive function takes a hit. The person may become easily confused, struggle to make decisions, or have trouble recognizing people or places they've known for years. For example, they might forget where they parked their car in a familiar lot, misplace everyday items like glasses or keys, or fail to recall a recent family event like a birthday celebration. In some cases, they may experience moments of clarity followed by sudden confusion, as if their mind is flickering in and out, creating a roller coaster of lucidity and disorientation that can be disorienting for both them and their loved ones. Emotional withdrawal is another common sign. A loved one who was once the life of the party, always ready with a story, a joke, or a warm hug may grow quiet, spending long periods in silence or seeming distant during conversations. They might avoid social gatherings, decline invitations to family events, or stop engaging in hobbies they once enjoyed, like reading, playing cards, gardening, or knitting. This withdrawal isn't because they've lost interest in their loved ones. It's because their brain is struggling to process emotions and interactions. Loud environments, crowded rooms, or complex conversations can feel overwhelming, leading them to retreat into their own world where they feel less overstimulated. Mood changes are also prevalent. Some individuals become more irritable, anxious, or easily frustrated, snapping at small inconveniences they once shrugged off, like a spilled drink, a misplaced item, or a change in plans. Others may seem unusually calm, detached, or indifferent to things that once mattered deeply, such as family milestones, holidays, or personal achievements. These shifts aren't just personality changes, they reflect the brain's adjustment to the body's decline. As cognitive function slows, expressing emotions becomes harder, and the person may struggle to respond to situations as they once did. For instance, a grandparent who once beamed with pride at a grandchild's graduation might now seem uninterested, not because they don't care, but because their brain can't process the event fully or express the associated emotions. For families, these changes can be deeply painful. Watching a loved one lose their mental sharpness or pull away emotionally can feel like losing them before they're gone. It's tempting to try to draw them back into conversations or activities, hoping to rekindle their old spark, but pushing them can lead to frustration or agitation. Instead, meet them where they are. Use simple, reassuring language, maintain a calm and familiar environment with familiar objects or routines, and focus on nonverbal connection, like holding their hand, offering a gentle smile, or sitting quietly together. Even if they don't respond as they once did, your presence can still provide comfort and a sense of safety, grounding them in a world that may feel increasingly confusing. If you notice increasing forgetfulness, confusion, or emotional withdrawal in a loved one, don't dismiss it as just aging. These are often early signs that the body and mind are preparing for the final stage. Use this time to be patient, create a peaceful environment, and cherish moments of connection, however small. Playing a favorite song, sharing a familiar story, or simply being present can mean more than words when communication fades. These moments of love and comfort can bridge the gap when words are hard to find, reminding your loved one that they are not alone. 4. Frequent infections and slow healing. A weakening defense system. As the body begins to wind down, one of the clearest physical signs is a weakened immune system. You may notice that a loved one who rarely got sick now seems to catch every cold, flu, or infection that circulates. Minor illnesses that once resolved quickly with rest or medication now linger, requiring longer recovery times or stronger treatments. Small wounds like cuts, scratches, or bruises take weeks to heal or may not heal at all, remaining red, tender, or prone to reopening. These changes aren't random. They indicate that the body is losing its ability to defend and repair itself effectively, a hallmark of the final stage of life. Frequent infections such as pneumonia, urinary tract infections, UTIs, skin infections, or oral infections like thrush become more common as the immune system weakens. These infections may not resolve as easily as they once did, even with treatment. For example, a UTI that once cleared up with a short course of antibiotics might now persist, leading to repeated treatments, hospitalizations, or complications like kidney infections. This happens because the body's ability to fight off pathogens diminishes as circulation slows and organ function declines. Even antibiotics, which once worked quickly, may seem less effective, requiring stronger medications, longer treatment periods, or multiple rounds of therapy. Poor healing is another red flag. Small scratches, sores, or bruises may linger or reopen, especially in areas with poor blood flow, like the legs, feet, hips, or lower back. For those with limited mobility, pressure sores, also called bed sores, become a serious risk as prolonged pressure on the skin can lead to open wounds that are prone to infection. Poor circulation means that oxygen and nutrients aren't reaching the skin and tissues, efficiently slowing the healing process and increasing vulnerability to further complications. For example, a small cut on the finger might remain red and tender for weeks, or a bruise might spread instead of fading, signaling that the body's repair mechanisms are faltering. Infections in the elderly often present differently than in younger people. Instead of a high fever or obvious symptoms, a senior might show subtle signs like increased fatigue, confusion, or reduced appetite. For instance, a loved one who suddenly seems more disoriented, sleeps excessively, or loses interest in eating might be fighting an infection even if they don't have a fever, cough, or other classic symptoms. This makes it critical to pay attention to changes in behavior, as they may be the first clue of a deeper issue. For example, a sudden increase in confusion could signal a UTI, while excessive tiredness might indicate pneumonia or a systemic infection. Families often find these repeated infections frustrating and disheartening. It's natural to push for aggressive treatments, hoping that one more round of antibiotics, a hospital stay, or a new medication will fix the problem and restore their loved one's health. However, at a certain point, the focus may shift from curing to comforting. Keeping the person hydrated, maintaining clean and moisturized skin, and minimizing physical stress can do more for their well-being than prolonged medical interventions. For example, using gentle skincare products, repositioning a bedbound loved one every few hours to prevent pressure sores, and ensuring they have access to water. Or electrolyte drinks can prevent complications, reduce infection risk, and improve comfort. If you're finding this information valuable, please comment number 4 below to let us know you're with us. Your support helps us continue creating content to inform and inspire. After Q1 5. Changes in breathing or circulation. The body's final slowdown. One of the most telling signs that an elderly person is nearing the end of life is a noticeable change in their breathing patterns or circulation. You may observe that their breathing becomes slower, shallower, or irregular, with pauses between breaths or moments where breathing seems to stop briefly. Some experience a pattern called Cheney-Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses, often most noticeable during sleep or rest. These changes may start subtly, perhaps only during quiet moments, but become more pronounced over time, especially in the final months or weeks. Circulation changes are also significant. You might notice that their hands, feet, nose, or ears feel cold to the touch, even in a warm room or under blankets. Their skin may appear pale, bluish, or mottled, particularly in the extremities, like fingers, toes, or knees. This happens because the body prioritizes blood flow to vital organs such as the heart and brain, reducing circulation to less critical areas like the hands and feet. It's a sign that the heart is pumping less effectively, conserving energy for essential functions as the body slows down. Shortness of breath is another common indicator. Even minimal activities like sitting up, speaking, eating, or shifting positions in a chair may leave the person winded or gasping for air. They might breathe through their mouth more often, need to pause to catch their breath during conversations, or feel unable to complete simple tasks without resting. Fluid buildup in the lungs can cause additional symptoms, such as a persistent cough, gurgling, or rattling sounds, or a feeling of tightness in the chest. This can make lying flat uncomfortable, leading them to prefer sleeping propped up on pillows in a recliner or with their head elevated to ease breathing and reduce discomfort. For families, these changes can be alarming and distressing. It's natural to worry that something urgent is happening or to encourage deeper breathing, hoping to fix the issue. However, these are often natural signs of the body slowing down, redirecting its energy to maintain only the most essential functions. While medical interventions like oxygen therapy, diuretics, or medications can provide relief, the focus should be on comfort rather than reversing the changes. Simple measures like keeping the room cool using a humidifier to moisten the air or offering small sips of water can ease discomfort and promote a sense of peace. Positioning pillows to elevate their head or providing a fan for better air circulation can also help. If you notice changes in breathing, cold extremities, or a bluish tint to the skin, take them seriously. These are signs that the body is conserving energy and circulation is declining. This is a time to be present, offer reassurance, and create a calm environment where your loved one feels safe and supported. A warm blanket, soothing music, a familiar scent, or a gentle hand to hold can make all the difference in their final weeks or months, providing comfort when words or actions fall short. Final thoughts: preparing with compassion and understanding. As we conclude this guide, let's reflect on the 5 signs we've explored: unintentional weight loss, profound fatigue, cognitive decline or emotional withdrawal, frequent infections, and changes in breathing or circulation. These signs may not all appear at once, and they may seem subtle at first, blending into the expected challenges of aging. But when you start noticing them, it's a signal that the body is preparing for its final stage, transitioning toward the end of life. For many families, accepting these changes is challenging. It's natural to want to fight against them, to encourage a loved one to eat more, stay active, push through exhaustion, or seek aggressive treatments to cure every ailment. But sometimes the most loving act is to listen to what their body is telling you. Instead of focusing on reversing the inevitable, prioritize making their remaining time as peaceful, comfortable, and meaningful as possible. This means cherishing small moments, whether it's sharing a favorite story, holding their hand, laughing over a shared memory, or simply sitting together in silence and ensuring they feel valued, loved, and understood. Understanding these signs isn't about fearing the end. It's about preparing for it with compassion and clarity. By recognizing these changes early, you can provide better care, make informed decisions, and ensure your loved one's final months are filled with dignity and peace. If you're noticing these signs in someone close to you, take a deep breath and remind yourself that you're not alone on this journey. Countless families have walked this path, and knowing what to expect can help you find strength, patience, and a sense of peace. Thank you for joining us today. Please share one thing you learned and how you plan to use it in the comments below. Your thoughts are incredibly valuable to us, and reading them inspires us to keep creating meaningful content. If you found this guide helpful, please like, subscribe, and share. Your support helps us continue providing insights to inform and inspire. We look forward to connecting with you again soon.